Hey guys! So I actually wanted to make this video because I kind of wanted to start something new. I go to school and it's a school for nursing, and I did or used to do like acting on the side before that, but I decided to continue my education on nursing, and I just kind of wanted to start like a nursing diary. I don't know. I don't know why, but I just feel like it's something new that I could bring to my channel, and yeah. But basically it's just pretty much stuff that I encounter, or maybe stuff that I want to rant about. I don't know, but I just feel like this would be a new topic for me to start on my channel, so this is why I'm gonna do it. So today's video is going to be about basically a rant, and maybe kind of like life lessons that I've kind of learned along the way. But basically, I go to clinicals, which means that whatever I learn in class, I apply it to the hospital, and that's where we do just like all the things that we learn. And so basically I just had like the worst day at the hospital, and I don't know, it's been bugging me for quite some time. It's not like a whole grudges or anything, but it's just something that'll be in my mind. So let's see what this is what happened. Okay. I'm probably gonna go on like a big huge rant, so I'm sorry. If you guys want to listen to it, you can exit out of this video, otherwise you guys can just stay. So basically what happened was I get assigned a CNA in the morning, which is like a nursing assistant, and like they're the lowest level of nursing nursing assistants. So basically I got that, and I have a partner, and basically we just help them assist whatever they need to do with the patient for the day, or whatever. So I had recently got out of the hospital for something. I don't really want to name why, but I have been kind of still recovering. So I was a little bit slow. Actually, I was a lot slow, just because I was trying to be careful of my body. That's basically it. And so I was a little bit slow, and it's really, this is what the patient wants. Like the patient, there were two patients. One was getting a shower, and another one needed help with her toothbrush and her basin or whatever. So that CNA, the nursing assistant, was helping the patient shower and clean up and whatever. And then later the other patient was like, oh, can you help me put my water away and my basin into the sink or whatever, after she had finished gargling her mouth and brushing her teeth for the morning. And so the other nursing assistant literally pushed a shower chair against me, and I know she saw me because I actually looked at her. She pushed it against me. She didn't even say sorry, and I know she saw me. And then the whole tub of basin that I was holding to go inside the restroom spilled, and I was just like, what the heck? She didn't say sorry, and I was just like, that's a little bit kind of rude. Okay, so then and I cleaned it up. She didn't even help me. She didn't do nothing. I cleaned it up. It wasn't even my fault, you know? I just think it's just common courtesy to say sorry or to help me clean it up, you know? But I did it anyway. I didn't try to pick a fight with her or be like, oh my gosh. But as the day continued, I just seemed to get this assistant doing a lot of things for like that were really bad towards me, and I'm just trying to help out, you know? So basically there was this next time she told me, my partner, we each get a partner, and she was putting on shoes in a patient. I was like, okay, sure, whatever, you know? I was a little kind of out of it since it was early in the morning. So I was like, okay, she got it, she's putting on the shoes. But the nursing assistant came back and started like kind of raising her voice, like, oh my gosh, why aren't you putting on the shoe onto the patient, whatever. And I was like, whoa, hold on, sorry, I thought she got it, you know. And so then I was just like, okay, here, let me help you. And she started being all like, no, it's okay, I got it, like raising up her hand like to block my hand away. And I was just like, that's kind of rude. I started to get annoyed after that. And then my mood kind of turned bad. And then next time I was just like, okay, I'm gonna go help her out. She told me, okay, can you put the trash into the linen and the trash bag outside the hospital room? And I was like, okay, I'll go get that. So I actually grabbed it with my bare hands. I forgot to get gloves. I actually went back to go get gloves, but she was like, oh my gosh, you're too slow. She grabbed it out of my hands and walked away with an attitude. And I was just like, whoa. I started to get so annoyed of her. And then I started acting like a big sour, sour person to her, because she's treating me so bad and she doesn't deserve to treat people like that, you know? And I was just saying to myself, calm down. She's just probably having a bad day. Because that's what I try to give people, is that if they've been acting bad towards me, or if they've been putting their stuff into me, I take it as like, maybe they're having a bad day. I'm gonna control my anger. And that's what I've been trying to do. But I just don't know why, in the end of the day, she just irritated me so much. Didn't even apologize, and she was just very, very demanding. I just didn't like that at all. But anyways, fast forward into the day, my teacher called me out because she wanted to pass medications. So in order to pass medication, she needed to get the blood pressure and the pulse rate of the patient. So you need to see whether to give it to the patient or not to give it to the patient. That will determine what will happen, right? So basically, I had gotten the blood pressure and the pulse of the patient, and then one of them I gave it. I had to mix it, stir it, whatever, inside the applesauce and give it to the patient. And then about the second bite or so, he didn't want it anymore, and then he spit it out on me. It got all over my uniform, and I was just like, great, just great. Damn. So then I went to go clean it up myself. Okay, that's part of nursing, right? And so my partner was preparing medication for the second patient, and so my teacher, she's strict, and they went to go prepare it while I was cleaning up after myself. But I had written down the blood pressure and the pulse on a notepad, and I had wrote 76, but the blood pressure was 46, which is really, really low because the average is 80. And so they were supposed to hold the medication, but instead my partner had given it to her anyway, him. And then later, I had told my teacher when I had finished doing the cleaning myself up, oh yeah, that's a 46 instead of 76. I wanted to tell her. And then she was like, what? And she like flipped. And so I was like, what? Oh my gosh. So I had, if I had seen that, if I had known or prepared the medication with them, if I weren't so busy cleaning up after myself, I would have gotten to tell them and know what the directions were for giving the medication. But instead, my teacher went back to me, and then she like blamed me that I was the one that wrote it, and I was gonna get written up for it. And I was just like, what? Are you kidding me? Like, did you not just remember who you did it with and what the directions were and everything like that? If you didn't know what my handwriting was, double check it with me. Like, I don't understand why she would blame like me for that. So that got me into such a bad mood, and I was just like, I don't even want to deal with this anymore, and I had been like gone out of school for a few weeks now, right? And so and last term, like, I had such a bad you know, clinical experience. I did not learn anything at all. I know it's so bad, but there was a problem with like the teacher or the instructor or whatever. So my partner was getting really impatient with me, and every time I would ask a question, this was another factor that added on to that. Every time I would ask a question, she got mad at me. She would give me the face of like you're such a dumbass, and I didn't like that, you know. I tried to be patient with her, and I tried, asking her to help me, but every single time she'd just give me that face. And by the end of the day, I was just kind of like fed up with it because she wasn't really trying to help me out, and I just felt, dumb just looking at her for it, because she knew everything. I mean, not everything, but like she knew the things of what to do because she had a good clinical instructor the past term. So my thing was that if you don't know how, if you don't want to help me, don't waste my time asking you. Just tell me, I want people to, I think that's what everyone like should do. If someone doesn't want to help you, it'd be so much easier if that person just told you, look, I don't want to help you, instead of giving you such a hard time for it, like giving me all these faces, like, oh my gosh, you don't know what to do looks. Like, I don't like that. I'd rather you tell straight up for me in my face, and then that's it. So anyways, I just cried because, I'm not the type of person to go up to my teacher and be like, oh, you know what, you're so wrong, like blah 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 blah. No, I am the type of person who would calmly talk to you about it, in like in a professional setting. And I'm the type of person who kind of respects you and, is kind of nice about it. But all in all, like, I think at the end of the day, if you really need to get aggressive, not aggressive with someone, but like, if you really need to make your point towards someone, I think that's the thing that I learned. If you really need to make your point towards someone, just say it. Like, if someone's bugging you, if someone's not treating you really right, or if that's not the whole truth, say your part. Because for me, it's like I don't want, my partner or my teacher or that CNA to like walk all over me, because that's not it, and people deal with things, and I understand. I try to let it go, but sometimes it's like you need to have a voice of like, you need to stand up for yourself, even though it's a little bit nerve-wracking. And I'm actually a shy person, but I can be really talkative and outgoing too. But when someone irritates me, I think you just need to say something about it. Otherwise, it'll be in your body, you'll hold it in. And so I just kind of cried throughout that day, and I just didn't like it. About them giving me a hard time. And I don't know, I feel like my teacher, she just does things in such a fast pace. And I know nurses are supposed to be fast and they're supposed to do very fast things, but it's like hard for me to grasp the concept if I don't learn it a few times, or if I don't learn it right the first time, like kind of moderately fast. Like, it'll be such a hassle for me. I do not like it at all. I just wish I would be able to practice it. That's it. Yeah, so yeah, just learning how to stand up for yourself. And I know it was a pretty bad day, but my friends were like, okay, well, just if you really think about it, just look at it the next day. Like, turn tomorrow because it's a new day. And I was like, yeah, but I really need to talk to them about, who's really right and who's really wrong, because like I said, it's not fair to let someone walk all over you. I don't know. That's it. That's all what happened, but I'm trying to get over it. I swear if I have that nursing assistant again. Yeah, I think that's it. That's all I really have to say about that day. Worst experience, and I hope I don't experience it again, but if I do, I will be sure to speak a little louder and to really make my stance. I hope you guys liked the very long video and my little story. Let me know if you guys like this, I don't know, or any thoughts, comments, or questions, info, advice that you would like to give. I'd really appreciate it, and I'll talk to you guys in my next video. Bye!